For Central African time, halfway through the second hour of the show, and we're going to be having our hashtag Africa Focus feature. This is part of the show where we look at some of the biggest concerning stories on the African continent, and we'll be heading over to Somalia, where a severe hunger crisis is threatening children living in displacement camps. There was a recent survey done by Doctors Without Borders, or MSF, in Baidoa, and it found that 1 in 2 children screened was suffering from acute malnutrition, a very, very devastating indication of just how serious the situation has become in that part of the continent. And these families, I mean, when you look at it and think about it, are already displaced by conflict, natural disasters, drought, there's food insecurity, and now they're facing another layer, another battle to fight for, which is finding enough food to keep their children alive and healthy. So we're going to be unpacking this study, what is driving this crisis, how our family is coping, and what is being done on the ground. And joining us is Allara Ali, spokesperson and Baidoa project coordinator for Doctors Without Borders. Allara, good morning. Welcome to News and Views. Thank you so much for joining us.
Good morning. Thank you for having this opportunity.
Pleasure is all ours. I want to jump right into the headline. The fact that 1 in 2 children that were screened in Baidoa were found to be malnourished. Can you just give us insight on just how serious is the situation on the ground in Baidoa right now?
Thank you very much. Situation is actually very concerning and serious, as you described it well in your first opening. Of course, when it comes to children, is more vulnerable and should be more delicate to deal with such alert. In Baidoa, we are supporting a regional hospital where we are supporting pediatric and mother and child health. So in terms of nutrition, the hospital was overloaded with a lot of unusual number of patients that reach up to 300% from usually what we are seeing. We also have our clinic around Baidoa, which was receiving more patients than usual, as it's available in the survey that you mentioned. We have screened more than 21,000 children in a matter of 6 months for this malnutrition. I'm just giving you MSF numbers, and it comes with a combination, of course, of preventable diseases that they contracted for the weakness of the vaccination or the lack of coverage in the vaccination from measles to diphtheria. So the child life is at direct risk. I'm going to try not to speak medical language, but more of a description of the situation. When you have this number of children, this is the new generation. So the new generation should not be facing hunger and consequences and complication of also diseases in anywhere and in Somalia, because already there is a lot going on, and as you mentioned, they are already vulnerable. And the same line, when you have malnourished pregnant and lactating woman, then the result will come an unnourished baby. And what we are doing now in Baidoa is providing nutrition support for both pregnant and breastfeeding mothers and girls, beside the malnutrition support for the children in Bay Regional Hospital and 7 community health center. So the situation in general, one of the worst thing that we have seen, that after you discharge from your medical treatment, which is of course limited, then when they go home, there is no food to have. So they will come relapse to the hospital with more malnutrition complication. If you are discharging them for the unknown, then you are just ending up in a vicious cycle where families cannot have enough food to maintain their children's life.
Very, very concerning. It looks like a loop, a circle that is never ending. I want to come to, just to put it to perspective for our listeners, some of the key drivers, some of the main factors that are driving this level of child malnutrition, what you guys have observed on the ground.
Of course, the health sector is a reflection for other sectors that was affected by funding cuts. If you stop livelihood support that was previously given to these communities, livelihood support and food distribution and even water distribution will lead to people reaching this level of vulnerability. As especially, if I can give an example of the water distribution, if the population in a drought setup cannot get water, then they will prioritize, of course, obtaining water better than having food in a place where the livelihood support that can guarantee that they have both water and food is not there. The food distribution is stopped abruptly after the funding cuts. And then we have, of course, the climate shock of drought that came later to make everything even worse. The other thing is the coverage of the health facilities. With the funding cuts, 80% of the health facilities was forced to close, that provided by humanitarian partners. So this, all of it together, resulted in a very concerning and crisis level situation in Baidoa and in all Somalia, and specifically in southwest state where Baidoa resides.
I want to stress a point that you make, the fact that humanitarian organizations like MSF are stretched, and I think we all know the reasons, the issues around budget cuts and donor fatigue being very, very significant over the years. How difficult has that made responding to the growing need in an area like Baidoa in recent times? Are you finding it really, really hard to work there when it comes to resources and making sure that they reach the right people, the people that need it the most?
Of course, it's very concerning, and at the end, one organization cannot cover all the need, because after US aid cut, as I said, all these sectors collapse, and at the same time, the capacity of the remaining sector is not covering the size of the needs. So at the end, MSF cannot do everything. From our side, we scale up all our activities, but it will reach to a level that we cannot cover. For example, enough food to be distributed, livelihood and cash, and some things that going out of our specialty. So from our side, of course, what we did was a scale up of drought response that reached up to even water tracking and latrine construction or bathroom construction to avoid getting communicable diseases and then complicate the ongoing nutrition crisis. So for our side, we can do limited to the size of the crisis itself, and we will do also in very small size. We only receive them in the hospital when they already relapse, and some of them are dead in the community. So then the real response should be scaled up and to be outside in the community, not only in a passive setup like when they reach the last level of medical intervention. So what we can do is, yes, we try to scale up. We scaled up the size of activities more than 6 times since the start of the year, but it's still not enough. One organization cannot cover everything.
And what would you say is urgently needed right now to prevent this crisis from becoming even worse than it already is?
What's urgently needed is, of course, boost the emergency capacity for the partner organization in humanitarian assistance, and at the same time, declare what's going on, because it starts with raising the alert that something is going on. So it needs a collective effort from the government and at the same time from donors from their own differences, whether it's a non-familiar donor or even individual people to intervene. What we are talking about is that people need to know first and then respond properly with all the factors that resulting in such situation, starting from food distribution, in boosting vaccination effort and coverage for vaccination, livelihood support, cash support, and all the water and sanitation sector. It needs to be a complementary response, urgent complementary response, and well coordinated, because even if you have big size of response that's not well coordinated, then it's a wasted effort.
I want us to take a quick break. When we come back, I want to continue talking about some of those mitigating factors, and I think most importantly, how can people support the work that MSF does, and where can they reach you and help you, make sure that what we're seeing unfold in Baidoa doesn't get out of hand. But we'll do that when we come back from the ads. The following is a paid political advertisement by the Al Jama'ah political party.
Regularization and the alternative political party for South Africa is the Al Jama'ah effect. Roads will be fixed, refuse will be removed, and personal safety in your homes, streets, parks, and pathways to the local shops and shopping malls will be our top priority. Al Jama'ah aim to regularize shack dwellers by giving them land tenure, regularize water and electricity supply by making it a reliable source. Vote for good governance, accelerated service delivery, excellence, and the best breed of councillors, mayors, and mayoral committee members. That is the Al Jama'ah effect. South Africa's alternative political party, the Al Jama'a Effect.
That was a paid political advertisement by the Al Jama'a political party.
Shimmer, sparkle, captivate. Nothing less than a masterpiece. Droplets of gold inspires precious design. Platinum bursts with intricate freshness, and every pure diamond becomes more than just a girl's best friend. Voda Gold Gem Jewelers, where timeless dreams become a reality. Come to us. We tailor-make designer gold, platinum, and diamond jewelry. Trade in or remodel your old gold. Clad yourself with classy name-branded watches. We offer insurance valuation and freezer card calculation. Visit us at 534 Ridge Road, Overport, or call 031 208 9142. Voda Gold Gem Jewelers, manufacturers of fine gold and diamond jewelry.
Discover the Africa of your dreams and surround yourself with her spectacular beauty. Relax beneath her serene sunsets and explore wildlife at its natural best. It's where the pride of Africa comes together. The Kwantu Private Game Reserve. Get to know the Big Five or cruise on an elephant safari game drive. Interact with lion and tiger cubs and enjoy world-class halal cuisine while we pamper you during your 5-star stay. Indulge in the true African experience. For reservations, call now on 042-203-1400 or visit kwantu.co.za. The Kwantu Private Game Reserve, the place of gathering.
When the perfect blend of stylish decor, exquisite halal cuisine, and warm hospitality come together, it could only mean Al Bait Lodge, your true home away from home. Al Bait is the ideal heaven for families, business people, and tourists with its 4-star family rooms and other luxurious facilities. Conveniently situated close to Port Elizabeth Airport, the beach, and other amenities, your stay will be truly unforgettable as you'll be taking home lasting memories of the warm hospitality, the serenity and tranquility that Al Bait has to offer. For reservations, call 041 583 6415 or visit www.albaitlodge.co.za.
Africa. Give the gift of clean water with Africa Muslims Agency. With every water well or borehole you donate, your drop becomes a river, reconnecting communities to nourishment, education, dignity and empowerment. Sponsor a water well for 17,000 Rand in Africa or a borehole for 65,000 Rand in Afghanistan or Africa. Quench the thirst. Reconnect the soul with Africa Muslims Agency.
Rejuvenating media day by day. This is Salam Media.
Welcome back. The time is 9:47 Central African time, and if you just joined us, well, it's our hashtag Africa Focus feature, and we're looking at Somalia, where there's a very, very concerning state of affairs. 1 in 2 children that were surveyed in displacement camps in Baidoa by Doctors Without Borders is suffering from severe malnutrition, and we're having a conversation with Allara Ali, spokesperson and Baidoa projects coordinator for Doctors Without Borders, and she's training us to give insight and to unpack just the scale of the humanitarian crisis that's unfolding in that part of the continent. And Allara, thank you so much for joining us and staying with us. Before we went into that short break, I wanted you to paint maybe a picture for us and for our listeners about just the general realities of working in an unstable region such as Somalia. How are you guys interacting with authorities, if there is any kind of interaction? Are they helpful in any way? Do they make it easy for MSF to operate and to try and give much needed humanitarian assistance to those that have been displaced to Baidoa?
Thank you very much. Actually, where we operate, it's okay, it's going well. It's very easy to coordinate with the authorities here, and at the same time with the community, as our direction is more about humanitarian assistance and giving for the needy population. So far we don't see any problem.
And for our listeners that are listening right now that want to contribute, that want to assist MSF in this very, very important cause, how would they go about it, and just how important would the assistance of the greater African continent and the world be at this time where funding is a bit tight for organizations such as yourself?
Yes, actually, after the USAID funding stopped, it affected most of our MSF operation around the world, because then it's the same as what's happening in Somalia. The law goes back to the private funded organization like MSF, or that the money and the source of the income coming from individual whom are donating. So every money that donated to MSF, it's going to a very much needy person, a child or a pregnant mother, or in different types of project that we have around the world, because every project has its own nature. But indeed, the size of emergencies around the world, beside, of course, increasing levels of humanitarian need in different locations where we operate, and like same as Somalia and other countries in East Africa and all around the world, then every dollar or euro or any currency is much needed to cover these kind of funding gaps, and at the same time urgent humanitarian assistance that will not wait for of course for people to sit down and then plan for a different funding.
There we go. Allara Ali, spokesperson and Baidoa project coordinator for Doctors Without Borders. Thank you so much for joining us in painting a picture of the reality of Baidoa. I really appreciate it.
Thank you very much.
Yeah, and I think if you want to contribute, you want to be part of making a difference, you can head over to MSF social media pages or their website, and you'll be able to get the relevant contact details on how you can help and assist. And I think, as Allara mentioned, it's been quite difficult since the United States of America cut funding to organizations like MSF. And yeah, they are doing the most with so little. And I think it's up to us as regular human beings listening and understanding what's happening in different parts of the world to try and assist where we can. We're going to take a quick break. When we come back, News and Views continues.
Breaking stereotypes, moving boundaries, joining hands. Salam Media.